always love this question. Why don't babies take their first breath when they are born in a water birth under the water? So during pregnancy, your baby grows in this lovely pool of amniotic fluid. That amniotic fluid is in your baby's lungs. Your baby's lungs have around about 100 mils of fluid on them, and they are practice breathing inside. But where they're getting their oxygen and their nutrition from is the placenta and the cord that's attached to them. And the amazing thing is, whether your baby is born vaginally or abdominally, there are lots of different mechanisms that help to stimulate that very first breath where they'll push out all that fluid on your baby's lungs and then take their first cry, where they will then convert to what you and I would perceive as breathing through our lungs and through our mouth. And one of those stimuli is the temperature changes that happens as that baby is being born. It's why sometimes in a vaginal birth, the baby's head can be out, the baby's crying, the body's still inside, the body's still there, and they're going, wah, and you're like, you haven't even been born yet, and you've taken your first cry even before birth has happened. Honestly, it's fascinating to watch as a midwife, and they're getting rid of all that mucus while their lungs have been squashed in the pelvis, and you can just see all this mucus coming out while this baby is screaming with its head out, and you're like, you haven't even been born yet. I love birth as a midwife. So basically, the temperature changes that are on baby's head, it's why we keep the pool temperature really nice and warm and body temperature, so that it's not helping to stimulate your baby to breathe before your baby's born in the water. Those lungs being full of water also stop your baby from taking a big inhale as well. Now, the other things that can stimulate baby breathing is stimulus. So with a water birth, we tend to be really hands-off as a midwife, and touching and rubbing your baby vigorously will help babies to breathe. It's why if your baby's taking longer than a minute to breathe on dry land, for example, or in a water birth where they just take a minute or two just to adjust to their surroundings, if they're taking a bit longer, we will rub them with a towel, because that stimulus makes them go, oh, and we're going to scream and we're going to get rid of that mucus off of our lungs. So another reason your baby doesn't breathe underwater is because we lift them up out of the water, place them skin to skin with you to begin with, make sure that your baby's okay, watch them for a minute before we do any of that rubbing and stimulation if your baby requires it. Many babies don't require this at all, not whatsoever. Usually just the temperature changes and placing baby's skin to skin, because remember, this baby is still attached to the placenta and cord, so it's still receiving oxygen and nutrients at this stage until it takes that first breath in, or until the cord is clamped and cut. And that enables baby to transition and adjust. Now, I do want to just give you a bit of preparation to say that if you're having a water birth, it is entirely normal for your baby not to scream and cry the moment they are born. In my experience as a midwife, most babies who are born into the water take about a minute or two to really take that first cry. And you've got to think, on dry land, that head has been craning, has been in the temperature changes for quite some time, so it's already starting that stimulation. In the water, where we keep the water temperature perfectly body temperature so that that stimulation doesn't happen under the water, actually the first time that baby's hit the cold air, that temperature change to stimulate it breathing, is when it is skin to skin with mum. And so babies can take a minute or two, and what we'll be looking for as midwives to see whether we need to intervene a bit sooner or not is what their tone, what their heart rate is by feeling their chest, what their reflexes are like as well, and whether they're opening their eyes and making any effort or attempt. If they're not, that's where we come in with a towel a bit earlier to just try and get them into that breathing mechanism. But for the majority of babies, they will take a minute or two before they take that big scream and cry. But they will just be looking around really chilled and like, what has just happened? 1 minute I was in this pool of water and now I'm in another pool of water. What's going on? There are also some other mechanisms at play, but babies don't breathe underwater in a water birth. Partly because we are really safe and secure in monitoring that temperature of the water, partly because we're hands off as well, but also because the physiological mechanisms that are happening during pregnancy that take time after birth to change into neonatal breathing.